helps regulate your blood sugar. It helps reduce your appetite. There's lots of studies out that show that just taking vitamin D and having a normal vitamin D level actually helps reduce belly fat and helps reduce that waist to hip ratio.
Hey y'all, welcome back to the Because Adulting is Hard podcast. I'm Alita and this is Heather Hartsock, and we are back talking about all things, okay, I like to call it female because that's what you're usually talking about, but there is definitely men that listen to this. We were actually just talking about a husband that was talking about the O shot. I'm going to send my wife in to see you. Yeah, I watched the podcast.
And then come in for one himself.
Absolutely. So welcome back. I feel like I've been gone soaking up vitamin D for a long time. So that is our topic today. I actually have worked with Heather probably about 2 years on hormones and things like that. But vitamin D to me was absolutely mind-blowing that number one, it's a hormone.
Yes, it is.
And number two, that the Psychiatry Association is actually really looking into requiring people to have a vitamin D deficiency test prior to treatment. And I'm loving that. So that's what we're going to talk about today. We are going to, Heather works for Revive Med Spa. Tell me all that stuff again.
Okay. So I am one of the nurse practitioners at Revive Med Spa and Wellness. So we do aesthetic based services such as Botox, fillers, facials, microblading, all sorts of wonderful stuff.
Like little things that tone your muscles.
Yes, the M-Sculpt, the M-Cellachair, all these wonderful things. But we also have a wellness program as well. So we do a lot of vitamin injections, vitamin IV infusions. We have an autoimmune program that patients that have that can come in. We do hormone replacement. We do medical weight loss, and we try to focus on the whole patient, not just disease specific. And we try to do a lot of prevention.
You do. And to me, that's one of the things that is so different. And that's one of the reasons that I keep having you on the show is that Revive I don't carry insurance per se. Like, I mean, I have a medical reimbursement plan, but I want to be in complete control of how I'm treated, and I don't want to be given a whole bunch of pills. Correct. And so that is something that is at the forefront of what Revive is doing. And so with the hormone treatment, you also do a full blood panel, correct?
Yes, correct.
So let's start from there. So when somebody comes in to see you, we talked about that on the last show. We talked about hormones. When somebody comes in to see you, you do a full workup, you do a questionnaire, you do all this stuff. So let's say it comes back and they do have a vitamin D deficiency. Let's first talk about what is vitamin D.
Okay, so vitamin D, they call it a vitamin, but it's really a prohormone. A vitamin is something that you have to ingest through your foods or from a supplement because your body doesn't make it. Vitamin D, your skin actually synthesizes it in the dermis when it's exposed to the sun. So therefore, you make this vitamin D, it then goes to your liver and your kidneys, and it's converted into the active hormone that then travels all around your body. There's every single cell in our body has vitamin D receptors, and so it's communicating with everything in our body. So they're finding that vitamin D plays a huge role in just about everything related to our body.
As a person that I honestly think I've had vitamin D issues most of my life. Number one, I'm dark skin colored, and from summer to winter,
yes,
I have a huge discrepancy in mood between the amount of sunlight I can get during the summer and then when it's dark and cloudy. I mean, like almost a winter depression from the lack of vitamin D. So I mean, this is the types of things that we talk about all the time. I'm like, wow, it really, 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 I mean, it causes me to have heart palpitations. Yes. I mean, it causes all kinds of things. So what does vitamin D do for your body? So like I was saying, I can physically feel when my vitamin D is low. So what does it do?
So vitamin D does a lot of things, and they're doing a lot of research on lots of stuff with COVID especially, and how it regulates your immune system. It helps to repair different cells in your body. It protects your DNA of your cells. It helps with the immune function. So a lot of people are concerned about the cytokine storm that people are getting. It's where your body overreacts to things, and vitamin D helps play a role in modulating that and help keeping that from going out of control. It also helps reduce inflammation. So it's great for our patients with autoimmune issues. A lot of times their vitamin D is lower, helps regulate your blood sugar. It helps reduce your appetite. There's lots of studies out that show that just taking vitamin D and having a normal vitamin D level actually helps reduce belly fat and helps reduce that waist to hip ratio. It helps.
I believe that.
It does.
I do believe that. Like, I mean, because you talk about that cortisol, weight that you carry, that we carry right here, that there's definitely a vitamin D correlation. I mean, I'm not a doctor, but
yes,
if you're asking me from a person that takes vitamin D regularly, there's definitely a correlation.
Yes.
Yep.
And then, of course, one of the main functions is it helps to increase the calcium in your blood. So one of the main functions is when you take the vitamin D, it helps to absorb the calcium from your intestines, from the foods that you're eating, to where then it can be shuttled throughout the body. So a lot of times if you're deficient in vitamin D, you're going to have dental problems, bone problems, osteopenia, osteoporosis, all of those kinds of things.
Really? I mean, especially for women as we're getting older, I mean, anything that you're doing with calcium is something that you read all the time that we struggle with. So we talked about why is it important, kind of was filled in there. How do you check your vitamin D levels and how often? Because we just said something about getting mine checked after I came back. So let's talk about that.
So with vitamin D, there's certain things that you can tell with your own body without having a blood test done. So if you kind of push on your sternum or on your shin, and it hurts, not just the superficial, but if it feels like a deeper bone pain, a lot of times that's a vitamin D deficiency. A lot of times when I have blood work taken, when they put that tourniquet on, like my arm will ache for days because I am vitamin D deficient. Even though I supplement and I've been taking it for over a year, I still am not at the level that I would like to be. So I still get those symptoms, but it's also a very quick and easy blood test. You can get it done from your doctor's office. If your doctor doesn't want to order it for you, you can go to one of those any lab tests now.
Walk-in labs,
yes, walk-in labs. You can have it ordered yourself. It's probably, at our office, it's less than $30. At the any lab test now, it's probably going to be less than $50. And it can be confusing because it's the normal limits. If you're under 30, that's what's considered deficient, but your level should really be about 50 to possibly 80.
Oh, that's one of the things that we've talked about a lot of times, that in standard medicine, I mean, I'm not knocking standard medicine, y'all, but in standard medicine, if you don't fall on that spectrum, you don't actually have a deficiency. Well, I still feel like crap.
Yes.
Well, you're a 31. Well, that's not, like you said, moving it over and really monitoring it to make sure. So we had actually just said, because I just came back from vacation, that we should actually do my blood draw now to see what it's gotten to at my happy place almost, at my calmest, happy place. And it's also interesting that you said about dental, because I would say probably over the last 5 years when I've definitely struggled with vitamin D, I've had more dental issues than I've ever had in my whole life.
Yes.
Thanks to being a 40-year-old woman.
Yes, exactly.
Things are great. Why are so many people vitamin D deficient?
So there are about 42% of Americans that are truly deficient, but about 77% are deficient. There's actually almost like a global pandemic of people that are vitamin D deficient because, we're not outside as often. We're indoor working. Our kids are indoor on video games. People aren't outside as much, and so we're not exposed to the sun. Also, depending on where you are in the world, the closer you are to the equator, the better you're going to have that UV exposure to the sun. So when you're living in more northern latitudes or when it's the winter months, you're not going to be exposed to it. And so a lot of people will have kind of the depression, anxiety that goes along with those wintertime months. But you'll also find that that's why they're hypothesizing that people get sick more in the winter.
I can believe
their
that.
vitamin D levels are dropping, and you need this higher vitamin D to keep your immune system functioning at its optimal.
See, to me, I don't know. I don't know. I guess because I didn't go to medical school, and I'm not a reader. I don't read a lot of things. I just had no idea that vitamin D did that many things in your body.
And you have to have cholesterol in your body to form vitamin D. So if you are taking a statin, you're going to be vitamin D deficient. If you have a liver disease or kidney disease.
We've talked about gut issues too.
Yes, gut issues. You'll have an
like
issue
an IBS
absorbing all of that. But with the kidneys and the liver, taking that pro-hormone and changing it to that active hormone. If you have any problems with your kidney or liver, you're going to be deficient too. And in my case, I feel like I have almost where my body doesn't synthesize it the right way, because we all have different genetic variations. And so I have to take even more to get my blood work to have a level that's higher. I've been supplementing for over a year and my points have gone up 6.
Oh, yeah.
6.
I mean, and some of it's just keeping to monitor. I mean, I've talked with other people about vitamin. It's kind of like a prescription. You have to get it monitored and you have to use your words.
Right.
We say it all the time. You have to use your words and say, hey, I'm still not feeling well. And we even have that conversation. Sometimes I wait till it's too long and you're like, why did you wait so long to come see me? Till you're not doing the... So how do you raise your levels? Like there are different ways that you do it. And I've tried it both ways that I know.
Yes. So of course you can try to get it naturally. Being in the sun, you want about 10 to 15 minutes of sun exposure.
Because that's one of the things. All the sunscreen we wear, I mean, we don't want skin cancer.
We wear big hats, we put on SPF, we wear long clothes, we try to stay away from the sun because we're concerned about skin cancer and wrinkles and sunspots. But we need that so that our body can absorb some of that. So if you can be outside even 10 minutes to 15 minutes, 3 times a week, that helps to raise your vitamin D level.
Okay. So naturally is one way.
Naturally is one way. But of course, if you have darker pigmented skin, you're not going to absorb as much. You're not going to make as much.
I'm a sun goddess. I require lots and lots of sun.
So then you can try to get it from food. There's a lot of very processed foods that are irradiated with radiation to produce this very low quality vitamin D3. I try to stay away from all of those because, it's not stuff that's good for us.
Right.
But things like cod liver oil is wonderful for you. Eating salmon, eel, herring, sardines. There's not a whole lot of people that eat that, so it's very hard to get that. Although I would have to say with the cod liver oil, it's 50% usually vitamin A, some vitamin D, and there's the omega-3 acids
and you're taking that in encapsulated?
I take it liquid.
Oh,
it's got a lemon flavor, so it's not terrible. But I've been doing, I've done the injections. I've done the high dose. I've done the everyday, and my levels haven't gone up much. So I'm trying something different.
I get it.
So now I'm, eating more salmon, things like that. Then we also, at our office, we do vitamin D intramuscular injections that you can get once a month. It's 50,000 to 100,000 that you get that once a month, and we'll do one. But after that, we want to check your levels because some people are like me, and it takes a lot to raise your levels. Other people, you just give them a little bit, and it raises their levels.
Well, I told you, we said it should last a month, and I was 2.5 weeks in, and I'm like, I can and so. So then we moved to the injections, but I know lots of people that love the injections.
Yes.
They get their injection, they get their blood done, they get their injection, and they like the way that it makes them feel. And then so then y'all do the injection, and then what else?
We have a once a week capsule that you can take. That's a 50,000.
Okay.
And then this is the one that I take every day.
Me too.
It's got the vitamin A, vitamin D, and vitamin K2. And it's a 10,000. I take this every day. Sometimes I take 2 of them just because I feel like I need more because my levels don't raise enough. The big thing is if you're supplementing with those high doses, of course, the vitamin D helps increase the calcium in our blood. So you don't want that sticking around in your vessels. You don't want that to contribute to kidney stones or coronary artery disease. So you need to be making sure that you've got some of the K2 that you're taking as well. That will help to shuttle that calcium that's in your blood where it needs to go, into your bones, into your teeth, to help prevent some of those.
Can you OD on that? Can you OD on vitamin D?
You can get too much
really?
Because it is a fat-soluble vitamin.
Okay.
And we don't usually see that.
I've
had 2 patients that have been at that kind of upper limit there, and I'm like, okay, you need to stop. You need to slow down with what you're taking, which they don't like it because they feel good.
Right.
I'm like,
I think if you told me that, I would cry.
You're getting too much.
Yeah. Okay.
But it is fat soluble, so it sticks around in your body for a while. It's not something that you can take like a vitamin C where your body's going to excrete it right away what it doesn't need. This sticks around. So that's why it's good to make sure that you're getting your blood levels checked, every couple of months.
Absolutely.
A lot of times insurance, if you're using insurance, will pay for it maybe once a year. But once you're not deficient, they won't pay for it.
Okay,
So
right.
that's where that cash lab comes in,
Which
nice
is
and handy.
Yeah, it's as much as people's co-pays at this
Yes,
point, you know,
yes,
most of the time. So
yes.
yeah, I like it. I like this topic. And we will have you back. I don't know what we're going to talk about next time, but I mean, something
It'll be
female
something
related.
fun.
Yeah. Or something that I come to you and I'm like, oh, let's talk about that. So, vitamin D is something that I'm glad that you and I are able to talk and that we're able to talk with people. So what do they need to do at Revive to schedule an appointment for this?
So they can give us a phone call at 409-299-4785,
Okay.
or they can visit us online at revivemedspa-wellness.com, or they can go to our Facebook page and, schedule an appointment on there. You have to go through our wellness side because all of this is done through our wellness
And there's
program.
actually, what is her name that's over there on that side that you should?
Amy Wilson is
Wilson,
the
okay.
other nurse practitioner that I work with. She primarily only does the wellness. So
Okay.
she does all of the autoimmune. She really specializes in autoimmune illnesses. And she also does the hormones
Nice.
and all the medical visits as well.
Okay.
And then I kind of do a little bit of both.
Okay. So nice. Okay. Well, thank you very much for coming on, and we will see you again. And remember to live happier because adulting is hard.